we should go ahead and start rounding. So it sounds like we have a lot of new friends. So we're probably going to need to keep our presentations to, let's say, less than 3 minutes. Yesterday they ran closer to 5, 7 to 8 minutes. So see if you can do your best to keep it down. Sound good? Sounds good. All right, let's go. All right.
Mr. Smith, is it okay if we come in?
Yes.
Hi, Daniel.
Hi.
So, Dr.
Hi,
Ryan, I have some things to tell you about Daniel for the night.
Okay, great. Hi, I'm Dr. Narayan. I'm the supervising attending. It's nice to meet you. Why don't we come around here so we can all share in the conversation with Daniel and his
Sorry
dad.
about that. So Daniel is our 1-year-old here with failure to thrive. He's been in the hospital for the last 2 days working on eating. Some things from the nighttime is he was febrile overnight.
So febrile, so Dad, that means that the baby had a fever yesterday.
Oh, okay.
And it seemed like he didn't feel well. So overnight, he did get some Tylenol, and then he started feeling better.
Great.
This morning when I came in to see him, he was sleeping. His lungs sounded clear. His heart was cleared out, or normal rate and rhythm, normal S1, S2, no murmurs at all.
So I see that you're looking a little bit worried.
Yeah.
All we're saying is Daniel's heart is doing great. His heart sounds
okay.
completely normal.
Yeah,
Okay.
nice and normal.
Okay, good.
And no congestion or anything that I saw on exam.
Great.
We did have some labs that came back today. So his sodium was 138, his potassium was 4.0, chloride 102, bicarb 21, BUN 5, creatinine 0.2, and glucose 80. And those were all the labs for the nighttime. So my plan for him overall is that we're going to keep monitoring him for failure to thrive, see if he's gaining any weight. He did have this fever, but he felt better after the Tylenol, so I think we can just watch and wait and see how that goes.
Okay. So I think in general, that's a great approach in the outpatient setting, is to not jump all over a fever, right? Because you've seen lots of fevers for Daniel in the past, and you have other kids, right? Who, that's what happens. Kids get fever sometimes, usually just due to a virus, and they get better on their own. Daniel's a little bit different.
Okay.
And the reason for that is because when you look at his past medical history, right, we've learned that Daniel's actually had a urinary tract infection before, right?
Yeah.
And they found that there was something in his kidneys, that the tube coming out from the kidneys was a little bit smaller than it should have been.
Oh.
And so that's what the nephrologist is following him for. So since we know that Daniel has a kidney that might be more prone to infection than other kids, given that he's had urinary tract infections in the past, and the fact that he's had a high fever today, is there anything else that you'd like to do instead?
Yeah, so given that, I think I probably would check and make sure that he doesn't have another urinary tract infection. And I think I'd probably do a catheter to check that.
Excellent, excellent. So the reason to do a catheter is he's only a year old, so we really can't get him to pee on his own, right?
Yeah.
Unless you've learned to potty train him at 1, which would be pretty impressive. And we also don't want to do a bag specimen, meaning put a plastic bag in his diaper around his private area to catch urine, because that's just prone to getting contaminated.
Okay.
So excellent idea. Totally agree with that. Excellent. So it sounds like we have a high suspicion that Daniel might have a urinary tract infection or pyelonephritis. When you have a child his age, so 1-year-old, who presents with a fever for a day, what else is in your differential diagnosis?
I guess just like a cold.
Okay, absolutely. It absolutely could just be a cold, especially since he has some congestion. And we talked in there already about the reasons to exclude some of the other causes because of his past history. What else could it be?
I guess you always want to worry about like cancer and leukemia and things in kids.
Okay, so tell me more about why you think it could be leukemia.
Well, I guess if you have fevers, or maybe if he's had fevers for longer and we don't know why he's having them, I would worry about that.
Yeah, so exactly. So you would want to think about that if you have longer term fevers. But for him, I'm not really worried about leukemia, right? Because he's only had fever for 1 day. He has no physical exam findings that are often seen in children who have leukemia, such as lymphadenopathy, large liver spleen, and we also have a CBC, which is stone cold normal. So all of those reasons make me say I don't think we need to work up leukemia right now.
Yeah. I'm sorry, I forgot to read that earlier.
Oh,
I had that.
that's okay. That's okay. I'm glad that you noticed that and had that available in case we needed that. But you're right. So next time it would be great to, even write that up in your note earlier to give yourself a prompt.
Okay. I'll do that next time. Thank you.
You're welcome.